Welcome to eLearning presentation on what is Ebola virus. Could there be an outbreak for Ebola virus? What are the signs and symptoms? Is there any vaccination and treatment? And how the virus is spreading to the world. What is Ebola virus? Ebola virus is also known as Marburg virus. It is a rare but deadly virus that causes bleeding inside and outside the body. As the virus spreads through the body, it damages the immune system and organs. Ultimately, it causes levels of blood clotting cells to drop. This leads to severe, uncontrollable bleeding. Both viruses are native to Africa, where sporadic outbreaks have occurred for decades. The disease, also known as Ebola hemorrhagic fever or Ebola virus, kills up to 90% of people who are infected. History of Ebola virus. Ebola first appeared in 1976 in two simultaneous outbreaks, in Zara, Sudan, and in Yambuku, Democratic Republic of Congo. The latter was in a village situated near the Ebola River, from which the disease takes its name. Genus Ebola virus is one of three members of the Filoviridae family, filovirus, along with genus Marburg virus and genus Quivavirus. Genus Ebola virus comprises 5 distinct species. 1. Bundibugyo Ebola virus, BDBV. 2. Zaire Ebola virus, EBOV. 3. Reston Ebola virus, RESTV. 4. Sudan Ebola virus, SUDV. 5. Thai Forest Ebola virus, TAFE. What are the symptoms of Ebola? Symptoms may appear anywhere from 2 to 21 days after exposure to Ebola virus, although 8 to 10 days is most common. Symptoms of Ebola typically include fever and severe headache, nausea and vomiting, severe sore throat, skin sores, joint and muscle aches, liver and kidney function stop, internal and external bleeding, diarrhea may be bloody. Risk factors. For most people, the risk of getting Ebola or Marburg viruses, hemorrhagic fevers, is low. The risk increases if you travel to Africa. You're at increased risk if you visit or work in areas where Ebola virus or Marburg virus outbreaks have occurred. Conduct animal research. People are more likely to contract the Ebola or Marburg virus if they conduct animal research with monkeys imported from Africa or the Philippines. Provide medical or personal care. Family members are often infected as they care for sick relatives. Medical personnel also can be infected if they don't use protective gear, such as surgical masks and gloves. Prepare people for burial. The bodies of people who have died of Ebola or Marburg hemorrhagic fever are still contagious. Helping prepare these bodies for burial can increase your risk of developing the disease. What is the current situation of Ebola? Ebola outbreaks have previously occurred in the Democratic Republic of Congo, Gabon, Sudan, the Ivory Coast, Uganda, and the Republic of the Congo. Currently, for West African countries, Guinea, Liberia, Sierra Leone and Nigeria, are experiencing an Ebola outbreak that was confirmed in March 2014. The World Health Organization declared it a public health emergency of international concern, PHEIC, on August 8, 2014. Laboratory tests used in diagnosis include Facts about Ebola. You can't get Ebola through air. You can't get Ebola through water. You can't get Ebola through food. You can only get Ebola from touching bodily fluids of a person who is sick with or has died from Ebola, or from exposure to contaminated objects, such as needles. Ebola poses no significant risk in the United States. Summary of this course. Ebola virus disease, EVD, formerly known as Ebola hemorrhagic fever, is a severe, often fatal illness in humans. EVD outbreaks have a case fatality rate of up to 90%. EVD outbreaks occur primarily in remote villages in Central and West Africa, near tropical rainforests. The virus is transmitted to people from wild animals and spreads in the human population through human-to-human transmission. Fruit bats of the Pteropodidae family are considered to be the natural host of the Ebola virus. Severely ill patients require intensive supportive care. No licensed specific treatment or vaccine is available for use in people or animals. Thank you for view this course.